Hello doctors, I'm your med buddy Arun and I welcome you to my 5th lecture of series Diseases Caused by Gram-Positive Bacteria. And in this lecture I will take you through the microbiology, epidemiology, pathogenesis, virulence, clinical features and treatment of diseases caused by Listeria Monocytogenes. So let's get started. Microbiology. Listeria monocytogenes is a gram-positive bacilli. It is non-sporulating, facultative anaerobe, beta-hemolytic, and it belongs to intracellular group of bacteria. It is a saprophytic bacteria, which means it is also a accidental pathogen for humans, which means that it generally do not cause any diseases. Epidemiology. This bacteria is a food-borne saprophytic bacteria. It can grow below 4 degrees Celsius and above 36 degrees Celsius, and it grows well between 4 to 37 degrees Celsius. And also it shows motility at up to 4 degrees Celsius and it becomes immotile at 37 degrees Celsius, which means inside body it is not motile. Yes. This bacteria generally contaminates cheese, milk, hot dog, cold salad, and all the refrigerated products. This bacteria is generally non-transmissible. There have no any outbreaks observed yet, but only person who have consumed the same contaminated food will get this pathogen and become the accidental host of this pathogen. Now the pathogenesis. There is a lot to know about this bacteria, but still what we know is this bacteria contaminates the food, and when the food is consumed it reaches intestine where it binds to intestinal internal receptor, which will give it entry to the intestinal cells. Within the cell this bacteria will proliferate. It will go layer by layers by crossing all the barriers that are blood-brain barrier, feto-placental barrier, and also intestinal blood barrier. The virulence factors. This bacteria carries beta-hemolysin, which is responsible for causing hemolytic. Generally, it causes variable hemolysis, and it carries listeriolysin, also called LLO, which is a pore-forming cholesterol-dependent cytolysin. It is also cytotoxic. What it does? When Listeria enters the intestine, there is probability that it will be get phagocytosed by the macrophages. This listeriolysin will act as transports for the phospholipase, means the enzyme that it produces with the help of listeriolysin will enter within the macrophage, and over there it will cause vacuolar lysis, means it will cause lysis of the phagosome and will get free and will start proliferating. One thing noticed about this bacteria is that this bacteria keep the cells alive. It does not kill the cells where it is proliferating, and this is a very important factor for its virulence. It has been seen the Listeria, which causes death of cells, does not cause much virulence because it needs a live cell for its virulence, for its growth. And what it does, it only triggers vacuolar lysis of acidic vacuoles. It has ACTA gene, which is responsible for producing certain kind of proteins which are called as VASP group of protein. What it is Wistak-Aldrich syndrome protein. What it does, it causes nucleation of actin filament and propels bacteria in and out of the cell. What does that mean? This bacteria does not have structures for motility, But once inside this cell, it produces a special protein using its ACT gene, which will cause the nucleation of actin filament. Means it is using the cytoskeleton of the host cell for its own movement. Such a smart guy it is. And though it tries hard to keep that cell alive, but because listeria in itself is cytotoxic, sooner or later the cell has to die. Now, how does it trigger the host immunity? Let's see. Within the first 24 hours or before the first 24 hours of the infection, neutrophils play the role. They try to control that. Then macrophages come into role, and after that CD8 T cells, which are cytotoxic cells, recognizes and kills the specific cells those are infected by listeria. This all triggers three kind of innate immune responses. Let me tell you which one. MYD88 dependent pathway, which is an inflammatory response which increases the number of cytokine, and inflammatory responses and clinical features will be observed in person. Second, it activates STING and IRF3 pathway, which is actually triggered by bacterial diadenosine monophosphate, which is a kind of cyclin, and it increases the number of interferon 1. The bacteriolysin produced by killer cells and phagocytes will cause an increase in number of inflammasome, which are responsible for subacute inflammatory reactions. Clinical features and diagnosis. As this bacteria is an accidental pathogen for humans, it does not cause diseases in normal life. So the first rule of law is rule out other causes first. The infections that it may cause include GI diseases, bacteremia, meningitis, encephalitis, pregnancy and neonate infections, but mainly in whom? In persons with HIV, in individuals which have undergone immune transplant and are having a glucocorticoid therapy or TNF-alpha antagonist therapy, which causes immunosuppression. It may show symptoms like a pregnant woman with bacteremia. It may be a sign of listeria infection. An old person with hepatitis and meningitis together. It may be a sign of listeria infections. Let's talk about GI disturbance. It is also rare, and causes of it are consumption of refrigerated food products or contaminated food products. What it causes? First of all, it limits only to the intestine mostly, and very rarely it progresses to generalized systemic infection. The symptoms will be similar to other intestinal infection, that is GI disturbance. Again, rule out other causes first. It may lead to bacteremia. In pregnancy, in HIV, and individuals with immunosuppressive drugs and chronic diseases, these people are more at threat with this infection, and bacteremia can be seen in this person. In pregnancy, symptoms of non-specific flu, which will include chills, myalgia, and arthralgia, and seeding complications may be seen in immunosuppressed ones. In meningitis, it causes the typical signs of meningitis, again only in person with HIV or immunosuppressed or chronic diseases. But there is a difference. The disease, which is the meningitis caused by listeria, will be of subacute symptoms progressing very gradually, and if it occurs, it may occur up to 10% of these patients HIV and immunosuppressed, and has a mortality of 26%. The symptoms will be the same: neck stiffness, fever, chills, convulsions, reduction in glucose level of CSF, and increased neutrophils from 100 to 5000 per microliter in CSF. It may lead to encephalitis. It is again the seeding complication of bacteremia in immunosuppressed or HIV patients. And what it is, encephalitis leads to multiple abscess formation on white matter of cerebellum, brainstem, spinal cord, and it leads to severe headache, neuralgia, and reduction in neurologic signs and fever. Pregnancy and neonate infections. What are these? As we talked about, during pregnancy, if there is subacute signs of flu, then it may be due to listeria, such as myalgia, arthalgia, backache. It is the major cause of preterm delivery. Those who are alive, those baby who remain alive, need antibiotic therapy. After antibiotic therapy, only 60% will show good prognosis, 24% will not remain, and 18% will be having some lifelong complications. It may lead to granulomatosis infantiseptica. What it is? It is Listeria neonate infections, that is early type of neonate infection. And what it leads to? It leads to granuloma formation, miliary abscess on skin, liver, and spleen. It may lead to late neonate complications, which are meningitis and arthritis. For diagnosis, what we have, we take the sample of CSF, amniotic fluid, we send them for culture and gram staining. What we will see on gram staining? We will see a variability on gram staining. We will see both kind of cells, gram positive and gram negative. PCR is the best choice for diagnosis, and serology is irrelevant. It won't show the confirmation. Now the treatment part. In HIV and immunosuppressed patient, we need to give them trimethoprim sulfamethoxazole as prophylaxis. For prevention is the best cure. We need to avoid, or the pregnant women need to avoid refrigerated food items, wash fruits and vegetables properly, and don't eat undercooked food, especially in pregnancy, HIV patients and immunosuppressed patients. Also, it applies on patients with chronic diseases. The antibiotic therapy for adults: ampicillin, very high dose from 2 gram per IV per 6 hours. Plus or minus, gentamicin can be given with ampicillin based on the prognosis and severity. It is to be given from 1 to 1.5 milligram per kg per 8 hours. Trimethoprim sulfamethoxazole, 15 to 20 mg per kg per 24 hours. It is for those who are allergic to penicillin. During pregnancy, if pregnant woman is diagnosed with this infection, then it is better to give her prophylactic medicine as group B streptococcal, anti-group B streptococcal antibiotics. It has shown limited exposure of infants by the listeria by use of these antibiotics. And last, do not give cephalosporin, it won't work. Thanks for watching.